Around the world, she's considered the mother of social work. And although she looked at things much differently than others of her time, the courage of her convictions changed the world for the better. Jane Addams was born on September 6, 1860, in Cedarville, Illinois. During her life, she wasn't interested in sympathy alone. She was more about structure and solutions and about building environments where people could thrive. In 1889, she co-founded Hull House in Chicago, one of the first settlement houses in America. It provided childcare, job training, English classes, health services, and legal aid to immigrants and working-class families. But Hull House was more than just a service center. It was a blueprint for advocacy in America at a time when it was in extremely short supply. Addams believed that poverty wasn't a character flaw, that rather it was a systemic failure. She and her colleagues collected data on housing and on sanitation and on labor conditions, and they used their research to influence modern legislation. They pushed for safer workplaces, child labor laws, and public health reform. In 1931, Jane Addams became the first American woman to receive the Nobel Peace Prize for her work in social reform. But her greatest legacy isn't the award, it's the profession of social work itself. Today, according to the Bureau of Workplace Statistics, there are more than 720,000 social workers in the United States. They serve in hospitals, rehabilitation centers, schools, home health agencies, and aging services. And every time a social worker advocates for safe discharge, coordinates home care, or protects a vulnerable adult, they're continuing her work in this most important and noble field. Now here is where it all intersects with us today. At the AgeWise Institute, and in the world of certified aging in place professionals, we talk constantly about environment shaping outcome. We respond to the assessment by the social worker. We respond to the social worker who says this patient cannot safely return home without changing their home. And that is systemic thinking. Jane Addams helped move social work from charity to profession. And today's social workers move patients from crisis to stability. In every safe discharge, every coordinated plan, every home adapted to meet somewhere where they are, that's the modern continuation of a movement that started way back in 1889. So during Social Worker Month, we don't just celebrate the work, we recognize the lineage of the mother of social work. From Hull House to hospital discharge planning to aging in place, the mission remains the same: to build environments where people can live with dignity. And that's the thread here. And it's still being woven every single day. So during Social Work Month 2026, let's all take a pause to recognize the history of the profession as well as Jane Addams and Hull House.